Hello?
Hi, good morning, Dr. Pierre. How are you?
I'm well. How are you, Salika?
I'm good. All
Okay, I have to make some
right.
adjustments here based on
Yes.
the video there. So let me see.
Yeah, I can still hear you.
All right. Um,
How's your day so far?
Pretty good so far. How's yours?
Not bad, not bad.
Okay, maybe let me prop this up a little bit more. Okay, that looks better.
Yes, it does. Yeah.
Maybe one more. Okay, that looks good, I think.
Okay. Can you see yourself pretty clear at your end?
I can. What do you think of my positioning with the background and everything?
Yeah, I think it looks Yes.
Okay, great.
Okay. There's a bit of do you have like two screens on or anything? Because after like I repeat, I hear it again at your end, like it's on a speaker or something?
No, I have it on my laptop. That's the only thing I have going.
Okay. Yeah. Oh, okay. Now it's okay. Okay. Right. Okay, so what will happen, Dr. Pierre, is like when have you used Google Hangouts before?
I have not. This is very
Okay.
interesting.
Okay. So when I'm talking, you can probably see like a circle right in the middle of the screen. Can
Yes,
you see that?
I
Okay.
can see that.
And then when you're talking, you'll probably see yourself on the screen. So I've just closed my camera off because when we do edits, it's much easier because obviously I'm not going to be on the interview when they do the edits.
Okay.
Um, and it'll be just only you. So can you just look on like where your camera is straight just so I can see like how your eyes position?
Yeah, I'm looking straight at the camera.
Okay, alrighty.
How
So
does
when
that
you're
look?
talking, yeah, that looks perfect actually.
Okay,
So
great.
will you be looking at you like that, or you're good to go?
I'm good to go.
Okay, alrighty, sounds good. All right, we're all ready then. So what I'll do is, excuse me, I'll just do a little intro to you about the DCA TV and introduction to you, and then I'll just welcome you to the DCA TV, and you can say anything you wish or whatever, and then I'll just go straight into the questions, and we'll just do the 8 questions that we have. And if you need to take a break or anything, or if you get a phone call, or it's okay because we'll edit everything out.
Okay,
Okay,
sounds good.
and yeah. I know you're a busy doctor, so I'll try to make this quick as possible for you. Okay, so I'll just start with the intro. Hello and welcome to DCA TV. I'm your host, Salika J, and I'm here today with Dr. Peterson Pierre, dermatologist of the practice of Pierre Skincare Institute in Thousand Oaks, California. Dr. Pierre is a certified dermatologist by the American Board of Dermatology. He received his medical degree and completed specialty training in dermatology at Stanford University School of Medicine. Highly regarded in his field of practice, he is the author of several scientific articles, abstracts, and textbook chapters. While a wide variety of procedures that enables patients to enhance appearance, his practice attends to patients' overall health, not just beauty. We're delighted to speak to Dr. Pierre today on the topic of Botox, which will give us a clear idea of some of the common questions which you may have. Welcome, Dr. Pierre, to DCA TV, and thank you for being on the show today.
Thank you so much for having me today, Salika. It should
Okay.
be an enjoyable interview.
All right, sounds good. Dr. Pierre, can you tell, is Botox the right solution for wrinkles?
Well, you know, there are a lot of misconceptions about Botox. There are a lot of different wrinkles when you look on your face, and Botox is the best solution for what are known as dynamic wrinkles. So the difference is there are static wrinkles, which are basically wrinkles that you can see on your face without any facial expression. And there are dynamic wrinkles that only appear when you make a facial expression, such as smiling, and you'll see the crow's feet around your eyes, or if you frown or squint, you'll see the frown right in between your eyebrows. What's interesting with dynamic wrinkles is that over time, what can happen over many years of making those facial expressions, the muscles that are involved get more developed, the lines get deeper, and then there's a point at which the lines become etched into the skin. So Botox is the best treatment for dynamic wrinkles. You inject them into the muscles, you relax the muscles, those wrinkles go away. Similar to when you frown, now once you have Botox in this area, you try to frown, you're not able to, so that area is nice and relaxed. With static wrinkles, which are wrinkles that appear without facial expression, Botox cannot really address those. That is more the realm of something like a filler, because now you have a valley that actually needs to be filled to be smoothed out.
Okay, can you hear me now?
I can hear you now.
Oh, okay. So next question is actually something that I would like to know the answer as well. So the next question is, will Botox make it impossible for me to make facial expressions?
So that's a common misconception with Botox as well. You need to understand that the Botox treatment is customizable. I'll give you an example. The most common area that's treated is this frown area because people don't like to look angry without being angry. So in that situation, in my professional opinion, it is best to eliminate that frown because a lot of times that frown is occurring without your knowledge. It gives a negative social interaction, which no one will want. If you eliminate the ability to frown, no one's going to miss that because when they're interacting with you, they don't expect a frown. However, areas like the forehead, for instance, when you raise the brows, some people would like those wrinkles minimized, but I do have some patients who tell me, I want that area frozen. I don't want it to move at all. So now it comes down to individual patient preference. I can put in enough in that area where it doesn't move, or I can put in less so that it softens it. You still have the ability to move. It's just that when it moves now, the wrinkles are less noticeable. Same thing with the crow's feet around the eyes. Some people are not bothered by their crow's feet at all. Some people, it really bothers them a lot. So typically I'll put some in, it'll relax the area, it'll improve the area significantly. However, the thing you need to keep in mind, when we relax the crow's feet, it does not change your ability to smile. It does not change the way your smile looks. The only difference is, remember when you were younger, you would smile, the area would still stay smooth. After a number of birthdays, when you smile, you get those crinkles, and then after a few more birthdays, even when you're not smiling, the lines are there. So it's a completely customizable treatment depending on what your goals and objectives are. But whenever I do Botox, the key is always to have it look natural. I never want any treatment that I do to announce itself. I just want people to be mesmerized by how good you look.
Okay, that's awesome answer. Will Botox make me look surprised?
Botox will not make you look surprised if done properly. So, what happens sometimes when you treat the frown or the forehead, you can relax a muscle to a certain point and another muscle tries to compensate. So, for instance, if we're relaxing this area right here to eliminate the frown, sometimes the forehead tries to compensate and pulls the brows up, and it makes you look surprised. That's a very simple thing to fix. You basically come back in, usually within a week after your treatment, so you can see the full effect. If for whatever reason you have this compensation in the forehead right here, all we do is add a little bit of Botox right there, relax that muscle, and everything looks perfect.
Super. Are there side effects with Botox treatment?
There are side effects with Botox treatment, just as with any medical treatment. However, I must tell you that Botox is one of the safest drugs ever approved by the FDA. So the side effects are minimal. Since it involves an injection, there's minimal discomfort with the injection itself. Anytime you're poked with a needle, there's a small chance of bruising. Headache and flu-like symptoms are extremely rare. And depending on the area treated, particularly if you're doing the forehead, there is a small chance of an eyebrow droop or an eyelid droop. Speaking of the side effects, obviously the pain goes away right after the treatment. If you get bruising, sometimes that can last 7 to 10 days. If you have a headache, typically within a few days. I've never had a patient have flu-like symptoms, but that's certainly something that's been described in the literature. And eyebrow droop or eyelid droop, those will usually resolve within a week or two.
Okay. Question. I have a nasty headache after getting Botox. Is this normal?
Unfortunately, it is normal for some patients. It's interesting because paradoxically, Botox has been approved to treat headaches, but in a very small number of patients, for reasons we don't understand, it can trigger a headache. So when that happens, I always recommend either taking extra strength Tylenol, ibuprofen, or something like that for a couple of days to eliminate the headache. And if you happen to be one of those individuals where you get a headache with Botox, I always recommend pre-treating with extra strength Tylenol the day before and the day of your treatment. That way you can continue to enjoy the wonderful benefits of the Botox treatment without having to endure the headache.
Perfect. How does Botox reduce wrinkles?
Well, it's very clever actually when you think about it. When we make these facial expressions, the muscles underneath the skin are contracting. When they contract, the skin crinkles. For instance, when you smile, these muscles right here contract and crinkle the skin. Same thing when you have a frown. Those muscles contract and crinkle the skin. So what we do really with Botox, we're not treating the skin, but we're treating the underlying muscular structure. We inject the Botox into those muscles and relax the muscles. Therefore, the muscles are no longer working out, and so the skin doesn't crinkle and it stays nice and smooth.
How does Botox differ from dermal fillers?
That's an excellent question that I get asked almost daily. So essentially what you're doing really, like I said, with Botox injections, you're treating the underlying muscles. So you'll inject those, relax the muscles, and so the skin typically stays soft and smooth. However, there are other areas where we are not trying to relax a muscle, but rather trying to fill a fold, a valley, a wrinkle. For instance, one of the most common areas where we'll do a filler are for the lines that go from the nose to the corners of the mouth. Right there, when you smile, those lines are accentuated. However, if you were to inject Botox in this area, you can almost see what the problem would be there. It would change your smile, and that's definitely not what we want to do. So when you have those folds, we simply inject the dermal filler in there, fill in the fold, make it nice and smooth. In areas where wrinkles are due to movement of muscles, such as around the eyes and the frown, the primary way to treat that is with Botox to relax the muscles. Now, there are times we'll all do a combination treatment. Someone may have a very deep crease right here, even when they're not frowning. So then we'll do the Botox, relax the muscles so that the wrinkle does not get any worse over time. A week later, after the Botox has taken full effect, if the crease is still there, then I'll go ahead and inject a filler to completely smooth out that area. So they're not really treatments that compete with one another, they're more complementary.
Okay, the last question, Dr. Pierre. Can Botox be used on all parts of the face?
Botox has been approved for 2 areas of the face, the crow's feet and the frown area. However, we have used Botox in multiple different areas and what's known as an off-label use. Off-label use simply means the product has been approved for treatment, but we're using that treatment in other areas that have not been approved. And that's something that is common in medicine with all types of treatments. So what we do, we'll treat the forehead at times. We'll also treat the chin because some people have a dimple or some like orange peel texture to the chin. We'll inject that to soften it. Some people have the corners of their mouth that are downturned and it makes them look sad. So we'll inject down in here to relax the muscles that are pulling on the corners of the mouth. Sometimes we'll even inject right under the nose because there's a muscle there that can pull down on the tip of the nose. So we'll inject it there to relax that area so that you have a better contour to the nose. Sometimes patients have lip lines known as smoker's lines, even though they don't smoke, and that really annoys them. So we'll do a little Botox there to relax that area as well. So Botox has a lot of different uses on the face, and as long as you have a very skilled and experienced person doing those injections, you can get the results that you're after.
Okay, well, that is all the questions as per the interview that we have. So I think all the questions and answers were very clear, and we have recorded all. So what the next step, Dr. Pierre, is I will be forwarding this to our edits team. And I wanted to ask one more question. I know we have 8 questions. Is your preference that we do like one whole video, or do you want would it be okay to do 8 separate videos because of the questions and answers? Which would you prefer?
To do separate videos.
Okay.
That way we can get probably more engagement from people who are looking at it. And also the videos are shorter because, as you mentioned, people's attention span is very short nowadays. So if we could have 8, maybe 1-minute videos or something like that, I think people would be more engaged rather than maybe clicking on one video and seeing that it's 5-6 minutes, then they may not be as interested.
Yes, yeah, that I just wanted to confirm, and I think that way you can post it, and just like you said, our attention span is very short, so listening to a 2-minute conversation where you're giving the answers better than listen to half an hour on and on. So yeah, definitely. So what I'll do is, like I said, I'll forward it. We'll create the 8 videos. We'll send it to you and get your approval. If you need to re-record something or you think something's just not right, we can figure that out from there. And so those 8 videos, we'll send it off to you, edit it, so all of this stuff that we're talking about will not be there, and make it perfect. And once it's approved and all that, you can use it for your website, your social media, and we'll put it on our DCA TV as well. So it'll be good.
Fantastic.
Yeah, so thank you so much, Dr. Pierre, for taking the time out of your busy schedule for speaking with me today, and I hope you have a great day.
Thank you, Salika. I appreciate the opportunity. I think this is a great idea that ECWA has come up with, and I look forward to seeing how far we can take it. And I hope you have a great weekend.
Yes, you too. Have a great day. Take care.
You too.
Thanks. Bye-bye.
Bye-bye.
Okay, what I'm going to do is do the introduction again so we don't miss anything in case there is something not clear of how we did it. Hello and welcome to DCA TV. I'm your host, Salika J, and I'm here today with Dr. Peterson Care Institute in Thousand Oaks, California. Dr. Pierre is a certified dermatologist by the American Board of Dermatology. He received his medical degree and completed specialty training in dermatology at Stanford University School of Medicine. Highly regarded in his field of practice, he is the author of several scientific articles, abstracts, and a textbook chapter, while Dr. Pierre offers a wide variety of procedures that enables patients to enhance just beauty. We're delighted to speak to Dr. Pierre today on the topic of Botox, which will give us a clear idea of some of the to the DCA TV, and thank you for being on the show today.